This is a new patient exam. You can see the space between the cuspid, and that's the way the patient's jaw would like to close, but when she does close, it closes all the way and touches. So her jaw actually moves a little bit to the right when she's functioning. And that's caused a lot of discomfort for her muscles. And you can see the wear on her lower forefront incisors. And those lower front incisors actually wear the top teeth quite a little bit, but you don't really notice it until later in this exam. We'll use a mirror and you'll see that. The gum tissue is actually very irritated. The tissue moves a little bit with air, but as we are putting the air and drying the teeth off, you'll notice as we get a little bit closer, the tartar that has dried on her teeth, and she really can't get that off with a toothbrush, and that's one of the reasons she needs to come in and get her teeth professionally cleaned. The front tissue there is a little bit irritated, but we'll see other places where it's a lot more, particularly behind the front teeth. You'll see that the gum tissue is even redder and that there's a lot more tartar on her lower anterior teeth. And as we move further back, and you can see the air pushing the gum tissue, you can see the contrast between the red tissue around the necks of the teeth and lower the more pinkish white tissue. Those little black spots were articulating paper marks. You can see her lower molars, and there's just a little bit of stain, possibly some decalcification. She's 25 years old. She's had the second molars for quite some time. You can also see the irritation, particularly right there at the cuspid where the tooth is crooked. And then as we go further back, we'll see the redness of the tissue there as well. This particular tooth, the first molar, has not formed correctly. In the womb, the tooth has always been like this, though the darkness that's occurred or the little white speck that's in between the teeth is a little bit of a concern. This is an angle from the side, and the enamel just never really formed there. And the brown color in and of itself isn't truly a problem. It's mostly the little decalcified area there. Now, this is her upper second molar, and there's really not very much going on. That's the first one now that we see here. If you look at the tissue a little bit, you can see a little clefting going on, and we'll get a look at that a little bit later. These are her premolars, and now we're going to be looking at her anterior teeth, and you can see the wear that's occurred, particularly on the cuspid. There's just like a tiny little dot, and then as you go further forward, there's the lateral that's in the center there, and then the central incisor. And the central incisor actually had chipped some enamel, and she had a filling done, and then she went ahead and chipped a little bit more of the enamel. That wide yellow area is indications of how much wear there is. That's actually the other tooth structure. You can see the other cuspid with the little spot there as well. So there's the two front teeth where it has the most significant amount of wear when she grinds. And she's really not aware of it. And when we look at the front teeth from a front view, you'll notice all the different edges that have been worn down and have made the teeth look quite a little bit worn for someone who's 25 years old. Here are some more on the other side, the molars. This is the first molar here, and the second one a little further back. Gum tissue is not as bad as the lower anterior teeth that we're seeing the redness. Patient does a fair amount of brushing. She has caused a little bit of recession, and you You can actually see the roots showing. Flossing has been something that she hasn't learned very well. You can see the yellow around the roots, that's where the recession has occurred, but there's also clefting here where the gum tissue has been a little rolled area, and that's actually floss. And when she's been flossing, she's been going back and forth as opposed to up and down on the side of the tooth. So we see a little bit of recession on the premolars, and the gum tissue is a little swollen, and flossing is something that, though she had been doing a little bit of it, she was doing it incorrectly, so it wasn't accomplishing what we would normally like to see. Good news is, even though there's some root exposed there, it doesn't seem to bother her, and that's nice for the patient. Now we'll go ahead and see the edges of these teeth in a second, and you'll see also the upper root area where on even the two front teeth she was causing some recession, and the teeth had continued to erupt, and so they're more of a triangular shape. And as she's worn them down, she's worn them unevenly. And you can see the edges there, and there's that tooth-colored filling that was done that's chipped. There's the root as well. And the tooth has continued to be worn down. This really shows on the lateral. And then as we go further back, we're just looking to see how the recession is occurring there, just so that we have a comparison, and hopefully we'll be able to maintain it this way with proper brushing technique. You also saw just for a second there the clefting of the tissue from the flossing. Now, because her muscles don't line up her jaw correctly, she actually quivers when she goes in the front here, and it's uncomfortable for her to move her jaw and in that position. And most people can do that without that being a problem, because throughout the day her jaw is not in a great place. It will quiver. Now here she's grinding off to the side, and her left side, and you can see how the teeth are lining up like a glove fit, going through those grooves on her upper teeth and wearing down the lower teeth. Now she's not aware that this is occurring, because this happens when you sleep, and most people that grind their teeth will tell you that they're not aware of it and that they don't do it. And that's part of the problem, because it makes it difficult to diagnose and difficult for someone to go ahead and seek treatment, and they have to either be shown something like this or believe their dentist. When she grinds in the other direction, you'll see that it goes through the lateral right there, and just in a perfect fit, and she's wearing down that lateral incisor as well. So this gives us a baseline of what her mouth looks like.